We have a proclamation tonight that is being read by Councilmember Wilkerson for National Health Center Week. Councilmember Wilkerson.
Thank you. Whereas for over 50 years, community health centers, CHCs, have provided high-quality, affordable, comprehensive primary and preventative health care in our nation's underserved communities, delivering value to and having a significant impact on America's healthcare system. And whereas as the country's largest primary care network, CHCs are a critical element of the health system, serving both rural and urban communities and often providing the only accessible and dependable source of primary care in their communities, serving 1 in every 5 citizens of rural areas. Whereas CHCs have served as beacons of essential resources and support in testing and treatment during the global coronavirus pandemic, and will continue to offer reliable, affordable, high-quality care against COVID-19 for America's most vulnerable and underserved communities. Whereas CHCs develop new approaches to integrating a wide range of services beyond primary care, including oral health, vision, behavioral health, and pharmacy services to meet the needs and challenges of their communities. And whereas the CHC model continues to prove an effective means of overcoming barriers to healthcare access, improving healthcare outcomes, and reducing healthcare systems costs, and whereas CHCs are on the front line of emerging healthcare crisis, providing access to care for our nation's veterans, addressing the opioid epidemic, and responding to public health threats in the wake of natural disasters. And whereas National Health Center Week celebrate America's over 1,400 health center organizations with over 12,000 service delivery sites, their dedicated staff, board members, patients, and all those responsible for their continued success and growth since the first healthcare center opened their doors more than 50 years ago. Whereas during National Health Center Week, we celebrate the legacy of America's CHCs and their vital role in shaping the past, present, and future of America's healthcare system. Now, therefore, I, Breeden Beggs, Spokane City Council President, on behalf of the citizens of Spokane, hereby proclaim August 8th through the 14th, 2021, as National Health Care Center Week in the city of Spokane, and encourage Spokaneites to take part in this week by visiting their local health centers and in celebrating the important partnerships between America's community health centers and the communities they serve. Also, Councilmember Munn, I'd just like to invite everyone on Tuesday, August the 10th at 4 o'clock, we will be having a ribbon-cutting ceremony for the East Central Health Dental Clinic starting at 4 p.m. We welcome you all to join us, so thank you.
And Councilmember Wilkerson, don't we have someone here to accept that? Mr. Weiser, do you want to introduce him?
I wasn't sure, but if he is, go for it.
I can introduce myself. Thank you, Councilmember Wilkerson, for reading the proclamation, and City Council members for your support of that. I'm Mike Weiser, Chief Strategy Officer with Chaz Health. We have 11 CHCs in Spokane providing medical, pharmacy, dental, and behavioral health services to community members regardless of their insurance or ability to pay. And the Native Project and Unify Community Health are also community health centers with 4 additional sites in Spokane, focusing on similarly underserved populations. This year, for National Health Center Week, we're especially celebrating the opening of 2 new clinics in the last year during the pandemic. We just opened our first behavioral health focused clinic in North Spokane. That clinic follows the Certified Community Behavioral Health Clinic model and will support what we all know is a growing need for mental health support in our community. and includes lots of collaborations with existing behavioral health agencies to really help patients connect with the treatment options that are going to work for them. And additionally, as Councilmember Wilkerson mentioned, the East Central Dental Clinic opened in October and was only possible with a great collaboration with the City of Spokane and with the MLK Center. Oral health disparities are especially high here, and so that serves a great need in the East Central neighborhood. It was busy from its first week of opening and has now provided over 5,000 visits to patients so far. CHAZ's mission is to continue expanding access to high quality health and wellness services, one neighborhood at a time, and we look forward to further collaborations with the City of Spokane to do that. Thank you very much.
Thank you. Really appreciate you being here tonight. We also have an